It was way back in 2004, after my MEd training. When I came back to Kumi, I found I didn't have equipment to work with, despite the heavy 3-year training in radiology. So I thought I should do something about it. Somehow I needed some equipment to start with. I bought a very old X-ray machine. By the time I picked it, it had been dismantled and kept in the chicken house. I did some work with it, but it only helped me for about 4 years and broke down. I was back to square zero. For 2-3 years, I didn't have equipment. I talked to my colleagues in the bank. So they were able to enroll a few of the assets that I had as security. And I got the first equipment. That time, USAID picked interest. They were going around interviewing proprietors of private facilities. So they came, granted me an interview, and then they said maybe we could be part of this story. The reason for their coming was that there was a general observation that private healthcare providers are struggling. First of all, to acquire equipment, what is expensive, and yet the banks are not so willing to give them. They consider them high-risk borrowers because we didn't have financial knowledge of how to manage the money. And that really struck me as very true. And that is how our relationship started. And immediately we were enrolled on a 16-module financial management training to run health as a business. That is our first engagement with USAID.
USAID has contributed a lot to our work. Initially, we didn't have correct procedures of running this facility. It was just getting the money from the clients. You don't even care at the end of the month how much you've used and how much you've banked. But after the training, now everything is smooth.
And they have been supportive. After the training, they come regularly to conduct counseling, to see how we are doing it. And I can say that according to the training we got, especially the financial bit, we've learned a lot of what I didn't know as a medical practitioner. For many years I was doing business, but I would never know how much money I've made. Whether I made profits or losses, I really didn't know. But all I know was that there was no money at the end of the day. I didn't have cash. So they taught us to basically keep records of each and every transaction. And out of that, we were able to generate our own financial statements, like income statement at the end of the month, cash flow statements. We see how the business is doing, and that's one very, very important thing we benefited from. And they would keep following us to see how we are doing.
We've gone through many things. We have gone risk management. We've gone through stock control. Most of the things we've gone through with them.
They also taught us how to manage inventory. Sometimes we just realized the medicines are finished. We just didn't care to follow what is the trend. Is it something that is going so easily? Is it drugs expiring? So they taught us to monitor stock. Sometimes our stock would just be in the open. They get finished. We don't know whether it's because we've used them genuinely or members of staff have picked them.
I've passed the skill to the nurses. I've gone through with them what we've learned together. They are even able now to fill those stock cards which we used not to fill. They can fill the stock book. I'm training them on how to handle cash, how to do the income statements, bank balance sheets.
I never used to bank money the way I do these days. Those days I would spend, then whatever is left is what I would bank. But these days I bank everything, and the bank is happy with it. They say that's how it should be. spending money as you receive it, even for the business, and without recording, is not good. You cannot balance. You don't know which money has gone where. But when you first of all bank all of it, you get to know what has been your gross revenue at the end of the month. You have records about it. And how you are withdrawing it. At the end of the month, you get a bank statement. You reconcile with the expenditure and you compare it with the gross revenue. I've been in this business for many years, but like I said, I was not seeing value for my effort. I was not seeing the money, simply because I didn't know how to manage the money. And I have seen people who have not really gone far in education, who have been very strict and stringent about managing their money in terms of keeping records and being frugal with the expenditure, really progress and become financially stable. If I have a chance to go to study, I will not study medicine. I will study accounting and business management. That's what I think.